for the Department of Medicine, and we are off to a wonderful start this morning. So it is my pleasure to introduce our next two presenters who are going to talk about our AWAM initiative, Advancing Women in Academic Medicine, Parsing the Promotions Process. So Dr. Hilary Babcock received her medical degree at the University of Texas Southwestern and completed medical training here at Barnes-Jewish and Washington University. After serving a medical chief resident year, she completed infectious disease fellowship and joined the ID faculty. She also received a master's of public health degree in epidemiology from St. Louis University. Currently, she is a professor of medicine in the department, and more recently was appointed vice president, chief quality officer at BJCHealthCare, where she is responsible for the development and implementation of the BJCHealthCare systems wide quality and safety strategy, including infection prevention and occupational health. She's a fellow of the Infectious Disease Society of America and the Society for Healthcare Epidemiology of America, and very active with the CDC as well, and is a CDC-funded investigator. And our other presenter is Dr. Sharon Cresci, and Sharon received her medical degree at New York University School of Medicine and completed residency at NYU in New York. After serving a chief resident year as well, she completed a cardiology fellowship at Barnes-Jewish Hospital, Washington University, and then joined the cardiology faculty. She's an associate professor of medicine in the departments of medicine and genetics with tenure, and her laboratory is in the Center for Cardiovascular Research in the Division of Cardiovascular Diseases. Her research is focused on the association of genetic variation with clinical outcomes in patients with cardiovascular disease, with the ultimate goal of advancing precision medicine approaches to diagnosis and treatment. She's a current chair of the American Heart Association Genomic and Precision Medicine Council's Professional Public Education and Publications Committee, and is on the editorial board of Circulation. And I have to say that both Sharon and Hilary have been just champions for the work that we're trying to do for culture change within the department and at the medical school when it comes to our advancing our women faculty. So I'd like to turn the program over now to Drs. Cresci and Babcock.
Thank you. Let me just share my screen. Okay, can everyone see that? Okay. I'm going to say yes. Okay. Thank you so much, Angela, for the kind introduction. And we also want to thank Dr. Frazier and Dr. Biani for inviting us to speak today about AWAM and how we hope this new program will help women advance their academic careers. I also want to say that I thought that Dr. Hinkle's talk was just amazing, and as Abby said, I think reinforced some of the ideas that we have and some of the things we're doing, but also gave us so many great ideas that I hope that we can implement over the next year. Before I start giving my presentation today, I first wanted to explain that Hilary and I have worked on AWAM since its inception in the fall of 2020. But as Angela said, Hilary now has accepted a new position at BJC, and so she won't be able to continue as co-director of AWAM. So I'll be directing AWAM by myself going forward. But I wanted to personally thank Hilary for everything she has done for AWAM, and to say it has been a real pleasure working with her on this important program. And also to thank her for agreeing to continue on as an advisory board member, so AWAM will continue to benefit from her valuable input. I now want to start this presentation with a story. This commentary was published in Nature in 2006 and was authored by Ben Bars. And I don't know how many of you are familiar with Ben Barr's story, but Ben started life as a girl, earned an MD from Dartmouth and a PhD from Harvard, and later joined the faculty of Stanford School of Medicine, where Barrs became a successful researcher as a woman in the male-dominated field of neuroscience. In the year preceding this commentary, Harvard University President Larry Summers suggested that differences in innate aptitude rather than discrimination were more likely to be the blame for the failure of women to advance in scientific careers. Harvard professors and others published similar arguments, and Barrs felt he had to respond to this. The commentary contains several personal examples from Barr's own life, such as being the only person in a large class of nearly all men to solve a hard math problem, only to be told by the professor that Barr's boyfriend must have solved it, and losing a prestigious competition to a male competitor, even though Barr's application was much stronger, and he was told that it was much stronger by his mentor. The commentary also contains important data from scientific studies, such as the one showing that women applying for a research grant needed to be 2.5 times more productive than men in order to be considered equally competent. And while the entire commentary impacted me greatly, I read this commentary as I was starting my own independent laboratory, and it really did affect how I was approaching my career and how I was thinking about things. However, one anecdote that Barrs told was really the one that affected me the most and has stayed in my thoughts ever since. He wrote, "Shortly after I changed sex, a faculty member was heard to say, 'Ben Barrs gave a great seminar today, but then his work is much better than his sister's.'" And I really think that this is such a unique perspective and really puts into light what we have to work against. So AWAM was started as part of a comprehensive strategy within the Department of Medicine to enhance the professional advancement of women fellows and faculty. I'm showing this here because I know there are a lot of people from WashU on this, and I did want to show a lot of where things are located on our multiple websites. So our website is located in a separate tab under the Inclusion and Diversity in the Washington University Department of Medicine, shown here. And our mission is stated here on the first page. AWAM is advised and supported by an advisory board of wise and experienced DOM faculty. And these faculty are committed to supporting the advancement of all women in our department. And as I said earlier, even though Hilary won't be co-directing AWAM with me anymore, she has graciously agreed to be on the advisory board. I also want to point out that we do have many male advocates on our advisory board. AWAM partners with WIM to build an environment that facilitates career advancement of women faculty and trainees, and is intended to collaborate with and complement the work that is done by the OFA, the OFD, and the AWM. The vision of our program is stated here. Advancing women in academic medicine works to achieve equitable career advancement for women fellows and faculty in the Department of Medicine at Washington University School of Medicine. And we started this program because we recognize that there are many potential barriers that women can face during their careers. And those barriers can be magnified by the intersection of gender with race and ethnicity, sexual orientation, and gender identity. We also realize that each person's career trajectory may be unique, and the path that is best for one person may not be the best for another. Our goal was is and was to help support women to achieve the career trajectory that they aspire to, whatever that may be. And our goal specifically is to provide an additional line of support for gender equity in promotions, pay, honors, and awards by developing interventions. So we first started out by reviewing what other successful programs we're doing to inform our priorities and to give us ideas for AWAM. And I'm just listing some of them here. But we did a pretty extensive research on these different programs at other institutions. And we recognized that these programs focused on at least one of the following three things: mentoring, leadership training, or networking. We then scheduled several town hall meetings to have the opportunity to hear from women faculty in the Department of Medicine about what they felt were their barriers to advancement and their ideas and recommendations for solutions that could help remove these barriers. We had a total of 6 town hall meetings, with each aimed at a particular level of faculty, but we made sure to let all faculty members know that if they couldn't attend one session or the particular session aimed at their level, they were welcome to attend another one. And we actually had a very, very good turnout and a lot of wonderful ideas that were, and discussion points that arose from these meetings. We made it clear that the sessions were true brainstorming sessions, that all ideas were welcome, and that although we might not solve anything during that particular session, we're making sure to note all of the ideas and discussion points. And we did keep a very extensive notes of what points were brought up during those sessions. After we had those 6 sessions, we organized the discussion points into several themes, which are shown here. And I'm not going to go through all of these themes, but at the top of the list was promotion. And then we listed the barriers and suggested solutions under each category. And an example of that is shown here. This is a partial list of the barriers that were identified at our town hall listening sessions. As you can see, there were, as I'm sure many of you can relate to and probably predict, there were a lot of concern and fear of how their pathway, I have track here, not meaning academic track, but kind of if they were on the right pathway, if their career pathway was a little less traditional, such as that, and they mentioned focuses that included education, diversity, primary clinical focus. And there were concerns that certain activities were more valued than others. For example, that research and publications were valued more than participating on committees or performing teaching responsibilities. And that kind of led to a discussion about how there was really a desire for credit for this unmeasured work, especially for women in URM, and how we could, as a department, value the less quantifiable metrics. There was a desire for better feedback and a discussion about the individual faculty members' career trajectory, and a desire for expanded discussion with the division chief to review progress, goals, and promotion. And then finally, there was the thought that there was a need for help with navigating all of the available information on promotions, such as CEPs, et cetera, and where they could find this information. The potential solutions, and again, this is not a comprehensive list, but just some of the suggested potential solutions, was to make it more explicit and expand what has value for the department, give credit for unmeasured work on faculty evaluation form, When meeting with the division chief, have a more individualized and extensive discussion about what specifically is desired and will result in advancement. The review of the faculty member's CV with feedback about what might be needed for promotion, and again, help navigating the available information on promotion CEPs. So I'd just like to walk through an example of how we proceeded after that. One of the potential solutions we identified was to make more explicit and expand what has value for the department. With the help of our advisory board and with the support of Dr. Frazier, we developed a document that explicitly stated what was valued in DOM. We then presented this document to our advisory board, and after their approval, presented it to the division chiefs, who gave us their complete support. And although this is long, I would like to read the statement, as we believe that this document provides the framework for further changes and improvements within the department. So this is our Department of Medicine leadership statement on inclusion, diversity, equity, and anti-racism best practices within the Department of Medicine. Diverse, engaged faculty, staff, and trainees are critical to the success of the Department of Medicine and represent its most valuable resource. The department chair, division chiefs, and all leaders are committed to creating a supportive environment where each member of the department can reach their greatest potential. We are dedicated to achieving this goal by ensuring a culture that promotes inclusion, diversity, equity, and anti-racism, and fosters career development and academic success for all individuals. We explicitly recognize the importance of faculty, staff, and trainees pursuing excellence in different aspects of the department's tripartite mission, providing the highest quality patient-centered clinical care, performing innovative basic clinical and translational biomedical research that will lead to improvements in human health, and providing exceptional education and training for physicians and scientists. We are committed to recognizing faculty, staff, and trainees across broad and diverse disciplines who provide exceptional scholarship and service to Washington University and our community. Together, we will consistently promote the highest degree of professionalism and integrity and ensure that all of our interactions with colleagues, trainees, patients, and staff demonstrate mutual respect, support, and compassion. We then moved down the list, if you will. As I said, there were a lot of concern among the women in our department that it was a little opaque about whether or not they were getting credit for all of their contributions. And specifically that there was no place on the faculty evaluation form for recording their diverse efforts. They wanted a more individualized and extensive discussion with their division chief, and as I said, wanted direct feedback. And so we then developed a revised and expanded faculty evaluation form that would be used across all divisions in the Department of Medicine. So it would be completely consistent across all divisions. And as I think you can see here, actually includes a lot more than a previous faculty evaluation forum. So I just want to walk you through some of the revisions we made. And first want to just state that we stayed up at the top that individual faculty members are not expected to have something to report in every category, but we wanted to comprehensively capture all possible faculty contributions. We especially wanted to capture contributions to diversity, equity, and inclusion activities, committees, and task forces, and other contributions that women are traditionally asked to do, and that we heard the concerns that they might not be getting quote unquote credit for. So as you see, we have sections here where you can explicitly delineate your contribution. And on this page, as well as community activities, teaching responsibilities, and patient safety quality activities. Importantly, there's now a career development section where the faculty member can specify specific areas in which they would like additional guidance, mentoring, and coaching, and a section to describe barriers that the faculty member experienced in the past year. This is particularly important coming off of several years of COVID and COVID-related barriers that affected women disproportionately. And we also have a section to list mentors, and it's hoped that the mentor section will ensure that the faculty member has a discussion with their division chief to identify appropriate mentors if they don't already have mentors. Finally, there is a section that is to be completed by the division chief and then discussed with the faculty member. And this section has an area to define opportunities for improvements and for discussing any areas of concern. And a specific area for the division chief to not only answer whether the expectations for promotion on the current track are being met, but to provide an anticipated timeline for the next promotion. And then, of course, after the goals for the following year are set, both the faculty member and the division chief sign the annual faculty evaluation form. And as I said, this new, revised, and expanded faculty evaluation form has been distributed to all of the division chiefs. And as I said, all were very supportive of using this form going forward. I would now like to show what AWAM plans to do to help women faculty navigate the available information on promotions, as this was another high priority issue identified at our town hall meetings. WashU has an abundance of resources, but sometimes it can be very difficult to navigate and find what is specific to the individual faculty member's needs. And so I just want to first walk you through some of the available WashU resources and where they can be found, and then show you how AWAM will try to help by organizing and providing links to the information that women need. So the Office of Faculty Development has a lot of information about the promotion process. And I know that they have been revamping their website, and it really has several incredibly great features that I just want to make sure everyone is aware of. If you scroll down that first page, and by the way, I've given you the links on each slide for these programs, just so you'll have them handy in your recorded version. But so if you scroll down the first page, you can see there's a link to the Appointment and Promotions Guidelines and Requirements, or the APGAR, which applies to all School of Medicine faculty. If you click on the Appointments and Promotions tab, there's a career planning information for the 3 different tracks: the Clinician track, the Research track, and the Investigator track, and for different career pathways, which are not the same as our academic tracks. Let's see here. This site has important tips for promotion, and I really do recommend that you work your way through this site. They have tips for reputation building, for mentorship, for education, for patient care, scholarship, and documenting your accomplishments. And just as an example, I want to emphasize that one of the tips, as it says here, is I tell all of my mentees this, but it's just much easier to update your portfolio as soon as possible after every talk, paper, or other achievement, so that when you go up for promotion, it doesn't become such a large, and formidable task. There are similar sections for those on the Investigator track that I won't walk you through, but again, I encourage you to go through. And then there's also a section that discusses the promotion packet and the necessary components that should be included in the promotion packet for each track and for each level. So as an example, with respect to letters of support, it states that to be promoted to the associate professor and professor level on the investigator track, 7 letters, at least 5 of which must be external, are required. Whereas for promotions to the associate professor and professor level on the clinician or research track, 5 letters are required, and they may be either internal or external. And so it's really good to go through this site as you're thinking of your career trajectory and start planning for who you're going to get those letters from, and thinking about what are the requirements that need to go into that promotion packet. This site also has information about the Clinician Educator Portfolio, or CEP, and the CV. It has links to the WashU format that the CV needs to be in, and also links to resources such as tips, templates, and workshops where you can get help on polishing your CEP. Oh, oops, sorry. If you look at the development tab, there is a link to a lot of different resources, including how to build your career in medical education. And again, I would just encourage you to walk through this site. However, oh, I'm sorry, I have it here. The development tab, there's information about the leadership development, mentoring, and how to build your career, as I've just said. There are also several other programs at WashU, multiple other programs that have incredible information, opportunities, and resources for faculty members with specific interests. The School of Medicine recently established a division of physician scientists that is focused on MDs who are conducting research. And this site has additional resources that are directed at physicians pursuing research, and is especially useful for those at the junior faculty level. So our plans are to expand AWAM's website to make faculty aware of the different opportunities available within DOM and throughout the institution, so that we're going to have one place that they can go to that will kind of direct them to these different sites, and so that it help them navigate it and see opportunities that are specifically available to them and will help their personal career advancement. We hope that this will allow women to more easily find and navigate the extensive career development information that's available at WashU. We expect that this page will also include information and links to mentoring and networking opportunities to make sure that women faculty can easily find these opportunities. For example, this is a new program called Meta that has been developed for trainees, and it will be launching on May 12th. It's a fantastic program that has been developed by Felicia Gomez and Jessica Silva Fisher, and it is focused on the needs of URM trainees, including junior women faculty, who can also take advantage of the mentorship opportunities that this program offers. And again, I would encourage you to hear more about this program on its launch day, which is May 12th as of now. So in my last few minutes, I'd like to give you a glimpse of what AWAM is planning for the upcoming year. We intend to continue to move forward and address the other priority issues that we heard in our town hall sessions. We also recognize that the importance of collecting data in order to assess the effect of the programs that we are initiating. And so we are working with Dr. Fraser Dr. Brown and Dr. Spencer's to gather this information and assess and be transparent about the effect of the programs that we are starting. We are also planning on developing a faculty leadership course that is specific to the needs of women faculty, and to promote the increased recognition of DOM women faculty and their contributions. I'm so glad that Dr. Hingle discussed the importance of recognition awards for women, because we do plan on addressing that in the upcoming year, in both looking at the equity of awards received by women in DOM, and also in establishing an AWAM award that itself recognizes the contributions of women in our department. Finally, I would like to encourage any of you who have ideas or suggestions to feel free to email us and let us know. The town hall sessions were extremely valuable for us to identify priority barriers to career advancement, as well as potential solutions. And we welcome the continued conversation around these issues, and really want to serve our faculty by addressing the issues that they feel are the highest priority. And so with that, thank you, and I will stop sharing my screen.
Thank you so much, Sharon. I really appreciate that great overview of the work that we've been able to do with AWAM so far, and the great plans that you have for carrying AWAM forward. Just a couple of questions to, and really happy to hear from anyone on the panel as well in response to these. The first question that we got through the Q&A was from one of our division chiefs, who asked whether, or who noted that in his role as division chief, I assume, he has observed that men sometimes negotiate more aggressively, for example, for salaries, clinical time, promotion, et cetera, than women may, and what are some strategies to prevent this from widening gender inequities. So I'll just mention a couple of things, and then I'm very interested in hearing from you and potentially from Dr. Fraser as well about this. There is definitely interest in providing sort of education and outreach for women about good ways to enhance their negotiation skills and to improve their comfort level with negotiating more firmly for their needs and for what they want to keep their job successful and to stay in their jobs. We know that some of those strategies can have differential impact, so that women who negotiate more aggressively are not always viewed as favorably as men who negotiate aggressively. Some other places have tried to have a more transparent standardization of salaries for different roles and responsibilities and titles, and that can be challenging in an academic environment where there's a lot of variability in the types of work that different people are doing. But I'm interested, Sharon, if you want to comment on that, and then Dr. Fraser, if you would also like to comment.
Sure. I do think that one thing that is very important is to make sure that when a new position becomes available, that it's posted and made available to everyone within the group who may apply. I think that AWAM would like to help work with that and make sure that there are that the standard practices of posting opportunities for advancement and promotion and success, which often comes with a salary increase as well, that everyone within the department is aware that of the best practices that are encouraged by the department, that these need to be posted, and all faculty members who qualify for the position apply for the position. And then often we have committees that are that are well balanced and are required to be well balanced to evaluate candidates, and so that so we really sort of address it at a level where the opportunities are made available, and sometimes that helps with salary equity and with this increase in opportunities. But I would also love to hear what Dr. Fraser has to think about it.
Thanks. That's a great question. I do think that there are common differences that propagate these subtle and then not so subtle disparities in compensation. So there's lots and lots of data demonstrating that men are more likely to negotiate for their first salary and every subsequent promotion. Men are more likely to look at other jobs and potentially leave, and therefore be eligible for retention packages, which could be associated with increased compensation. Men are more likely to continue to ask for raises or for increases for leadership positions, and to make others aware of their interest in advancement. So there's some very interesting studies that demonstrate that many, but not all men are more likely to consider themselves really highly qualified for positions ahead of time compared to women with similar qualifications who may not feel that they're ready or sufficiently experienced to apply for a bigger job or a bigger position. So one thing I would encourage all women to do is to ask, with every single job opportunity, with every position. I think a simple question is the salary you're offering me equitable and similar to men in these positions? So that simple question, which is hopefully non-threatening to people, does raise awareness and make people go back and look. And I personally love it when people ask me that, because I don't remember everyone's salary in the Department of Medicine, unfortunately, with 750 faculty. So it does prompt me to go back and look and double check. And then it provides an opportunity to correct things, if there are inequities. I think what we do in the Department of Medicine now in every single division is every time we are offering a position, we are intentionally checking for equity, both for new positions, but also if we end up giving a retention package to somebody, we look and sort of see how does that impact others, and how can we, ensure that others are being brought up at the same point, and that's not exacerbating inequities. I do think it is super important for women to understand the promotions process, to have a career development plan, to have a niche, and to be really focusing on having regular meetings with their section chief, their division chief, to update them on their progress, their plan, and to make sure that people are aware if they have interest in additional leadership positions or are ready for the next thing, because that also helps people think about trying to help advance their careers. And then people really do have to keep up their CVs and clinician educator portfolios. And I'm so grateful for you all developing this standardized evaluation tool, which I think will allow better prompting of people remembering and documenting what they're doing. I think, unfortunately, some women, many women, are under documenters of their achievements, and that makes it also hard. So I would encourage everyone to really keep careful track of their contributions, their accomplishments, their productivity, what they're doing, but then also for everybody to help amplify their good work, because that is super important as well.
Thank you both for those comments. I think to just a couple of comments and follow up. One, as a mentee of Dr. Fraser, I have had the career development plan mantra in my ear for years. And I do now pass that along to people that I mentor. And when I give leadership talks, I always ask. I was just at a conference and giving a talk, and I asked, how many people here have a career development plan? And Dr. Fraser, you would have been very unhappy with the response. Like, most people did not have a career development plan. And of those that did, the ones that had like a 1, 3, and 5 year goals, even smaller. So I really do think that's very helpful. And it really helps you be very specific and intentional about where you want to go. And it helps you outline the steps that you need to take to get there. And once you have that, that is also such a great tool to take to your boss and your leader and to say, this is what I think I need to do to get to this goal, which is my next, landmark that I want to hit. Does this look right to you? Am I doing the right things? Are these the things that will get me to that next step? Because it is difficult for everyone to give feedback. Nobody loves giving feedback, sadly, or few people love giving feedback. Dr. Spencer maybe is really good at giving feedback as an educator, but it is a challenge for everyone, and sort of opening that door to ask for that feedback and to have real specific things for your boss to talk about with you will really help in that conversation. So I think that's always a really good piece of feedback.
If I can I'm sorry, Hilary, if I can just build on that, if you have that plan in place, it also helps you, I think, prioritize what you're going to agree to and what you will turn down as maybe not being within the same, not helping you achieve your goal. Because I do think women are asked to do so many things and we are inclined to say yes. And many of the things we agree to do not actually help us get to the career goal that we intend. And so if it's sidetracking you and you have your plan, you can look at it and say, yeah, that isn't really something that is going to be useful to get me from point A to B. And so I agree that is a really important and valuable tool that you can use.
Someone also asked in the Q&A about, said they enjoyed seeing the evaluation, which is great to hear, and asked whether this will also be pertinent or used for those primarily on the research side, the PhD side, and the answer to that is yes. We looked at it with an eye towards both tracks, sort of more the basic science track or more the clinical and clinical educator track, to be sure that it could capture information regardless of the track. That's another reason that it has on the top, like, you're not expected to have something in every category, because that would be kind of crazy if you could meet like all the PhD requirements and all like the clinical educator. I mean, more power to you, but that would be a lot. So I think that should help for both sides. And that's a great idea. She mentioned it would be great to disseminate this to the younger trainees so that they can see the evaluation form or the evaluation form in advance as they start on their career, so they know what kinds of things they should be aiming for. And that's definitely something that we can to disseminate. Go ahead.
It is already on the AWAM site. So if you go there to that tab, it's there's a link. It's WashU password protected. But anyone at WashU should be able to access it and go through the whole form, because I did not go through every single part of the form, but it is there, it's accessible. And yeah, I would recommend going through it in advance, well in advance of meeting with your division chief.
I just want to remind everybody that we have 3 faculty tracks: the investigator track, the tenure track, the clinician track, and the research track. And we value all of the faculty on all of those tracks, but they have very different job descriptions and very different criteria for promotion and expectations on each of those 3 tracks. So I think it's really important for people to understand what track they're on, to make sure they're on the right track that fits with their career goals. And you can switch tracks, but we're not supposed to switch back and forth and back and forth. and that people also really spend time talking to their section chief and their division chief about their goals and plans, because each division is a little different also, right? And so I think it is super important that people understand their roles, their responsibilities, the goals, expectations, and that they are aligned with the leadership, both of the division and the department, so we can ensure their success. And I just want to remind everybody that I meet with all the division chiefs every fall, and we go over every single faculty member's CV and clinician educator portfolio, their career development plans if they submit those. And we talk about, you know, faculty success and faculty development, and we use that time specifically to talk about, you know, how the faculty are doing and plan for promotions. And so we rely a lot on the documentation that is provided by the faculty. And so there is a lot more work, I think, that the faculty can do to really track and document their successes and accomplishments, and also, you know, aligning and discussing with their section chief or their division chief or both. For many of the big divisions, you know, it is not physically possible for the division chief to meet with every single faculty member, you know, regularly to do this. So that is often delegated to the section chiefs, which is very appropriate. And then the section chiefs are talking with the division chiefs and talking to me. And as much as I would love to meet with every single faculty member, you know, regularly to facilitate mentoring and career advancement for them, that's not super practical either. So I think we're also doing lots in groups and using the Office of the Faculty Development to present workshops on how to do your CV, how to do your clinician educator portfolio, reminding people about the promotions process. And those are done, and historically were done a lot live and in person before COVID. And then we're done, you know, by Zoom during COVID, and are all recorded. So those are online again. But Dr. Millen Anacott, you know, is really doing a great job expanding those programs as well.
So I completely just want to, you know, emphasize what Vicki said. If you actually take the faculty evaluation form, at the very top, you have to define which track you're on. And then if you have that document open and you go to the OFD website, there are hints and resources available for each of the individual tracks. And it explicitly says what is going to go into your promotion review, what specific components will contribute to whether or not you're promoted. So if you use the faculty evaluation form right next to those sites, and we'll provide the links on the AWAM site, I think you can go through and sort of make sure that you're checking off the boxes. And if there's something that's not, if you can't document something in one of the key areas, then that's a focus for the next year to try and build up that portion of your CV or your CEP, depending on which track you're on, to make sure that when you meet with your division chief, that you have checked off all the boxes that are necessary requirements for promotion.
I have one other thing I just want to bring up, and you guys can all yell at me, but the other thing that I think we really need to help women feel good about doing is asking questions. I cannot state how many times in conferences, grand rounds, noon conference, even in this, which is, I think, totally dedicated to women's career development, that women, for any of the number of reasons, don't ask questions. And asking questions and interacting is part of career advancement and recognition, and there are no dumb or bad questions. And if it's a question in your mind, probably 20 other people have the same question. So if I were going to empower each and every woman on this conference today, I would encourage you to start raising your hand and asking questions in a more proactive way to help advance your career as well.
And that plays a little bit into what I was going to ask about next, which is other ways for women to be sure that they are getting recognized for the work that they are doing, and opportunities for that recognition. And also the sort of interplay between that recognition and retention of women faculty. So we know that there are challenges, Dr. Hinkle talked about as well, challenges for women in work-life fit, as she called it, and that at different phases in both your own life and your career, that those can be challenging. And how can we better support retaining women, because our focus in AWAM is primarily on ensuring that women are getting equitably promoted when they should. But if they've already left, then we obviously won't get the opportunity to promote them. And we really want to be sure that that retention part plays in. So I know Sharon mentioned, and our Grand Round speaker yesterday mentioned the importance of being sure opportunities are available to everyone so that people see that they have leadership opportunities, and can then, when they move into those can be celebrated. Dr. Bayani mentioned the importance of using our social media feeds to be able to highlight and amplify the accomplishments of women. Other thoughts from any of you, including Dr. Bayani, Dr. Spencer, anyone else who'd like to chime in about ways that we can really help to retain our women faculty as well?
I just had one additional thought, which is which builds on what Vicki said, that if you have a niche and you develop that niche and it's different than anyone else on the faculty, that kind of lends itself to more recognition. And then if you get over the hump of self-promotion and you try and get yourself out there to give talks and to get that national recognition, I think you're in a really good sort of bargaining position, and also have more fulfillment about your career and more happiness, which is what Dr. Hinkle was also referring to. So I think getting back to that same career development plan, if you really are very thoughtful about defining what that's going to be and what is valuable to you as part of your career, it is a really important time to take to do that and to really, really thoughtfully come up with the answer that's individual to you, because it will be different for everyone, obviously.
I think those are great thoughts. And I think, when we think about the topic of retaining women, a lot of it goes back to belonging, right? And so the more we can do to help everyone feel seen, feel valued, and feel like they belong. If someone isn't necessarily feeling like they belong, it's probably more challenging to feel like they self-promote. But when you have a group around you rallying with you and everybody's reveling in your success the same way you are, it begets more promotion of yourself, of others, the amplification of others. And I think it's, groups like these and FWIM and AWAM and things that bring women together to say we go so much further together. Everyone has a place, everyone belongs, and helps cheer for each other and helps say, hey, there's this award, you should go for it. Do you want me to nominate you? Then those who really aren't used to asking for it or haven't had the privilege of being somewhere where they could, or maybe someone got burned by asking for it or sharing something they were excited about and called a name or a bragger or made not to feel welcome, and then they don't try again. And so I think that creating those mentors in the moment and sponsors in the moment of, hey, what are you working on, what are you thinking about, saw your presentation, that was great, are you going to submit it somewhere? We can keep doing that for each other and making these suggestions and getting everyone excited about putting themselves out there, putting others out there, promoting everyone, and knowing that when you create that culture, everybody can speak up a little bit more, everyone can belong, whether that's something that you normally would have done by your own personality or not. So I think we're on the right track to creating all of these. And I imagine that's the scenario that's going to retain women, because who would want to leave a community and a network where they feel so seen, so valued, so lifted up? No one's going to leave that.
Yeah, I want to echo exactly what Abby had said as well. I mean, that was one of the things I was thinking about is when I was putting this presentation together, is the value of community, I think, is really important, and sort of to underscore that, and sort of feeling like you belong in your workplace. And it's also important for our trainees too. So we have our work environment, our learning environment. But the other part that I was going to just sort of emphasize, and I think Sharon and Hilary did a great job about talking about sort of that importance of the career development plan. Having that helps you sort of be able to decide what brings you the most joy and passion in terms of your career, right? So it doesn't have to encompass the entire part of what you're doing, but even if it's a small part, that's a part that can really keep you going and really energize you and give you that they give you that fuel to keep going. And if you have that, and so sort of you're able to identify what that is, then when those opportunities come up, it really helps you to make those decisions and create those boundaries of what you say yes to and what you say no to, because everything you say yes to, you know, that just takes away from something else, because there's only a certain amount of hours in the day. And so I think that can help with some clarity. And then if you have that passion and people know about it, so that amplification part, letting others know about what's really important to you, then, you know, that also helps with when opportunities come up that someone can sort of be like, oh, I heard you're really interested in this. Take a look at this email. Don't delete it. This might be something that would be really important to you. So again, sort of having that sense of community, really being clear about sort of where you want to go, I think can be really helpful. And then sort of having a space where people really feel comfortable sharing that with others, I think is really important. So that's what I would say in terms of the retention. I think that's really helpful.
So there is a question in the chat. So more power to you. Thank you for typing the question in there. You get extra credit. I wish I knew who you are so I could give you a pat on the back and a hug and a big star on your CV. But more people should type questions in. So it says, the question is, might it be possible to create an advocacy position independent of department leadership? Think of an ombuds type person whose role is to accompany faculty to review and promotion meetings with leadership. A second set of eyes and ears to objectify the discussion and ask questions and make points on behalf of the faculty member. Available, but not necessarily required. That is a great idea and something that I've never thought of. So thank you for bringing that up. And we can certainly investigate how that kind of position or advocate might really help people sort of bridge that gap and amplify their success, but also be a trusted resource, across multiple divisions. So we will certainly look into that.
I think that's a great idea. I recall way back when I was, I think, just joining the faculty, we had to have at that point sort of a faculty review committee that would meet with the fellows or the junior faculty and have sort of a review with them. And at the time, your mentor was actually explicitly excluded from the meeting because it was felt that like your mentor would be would obviously be biased on your behalf and that you were supposed to stand on your own. So I just remember being in this meeting with like 4 very senior male faculty and like having to defend my my career up to that point as like a first year like faculty member or last year fellow. And they were all ID physicians. They were all lovely people and very kind, but it was still a little intimidating. So I'm glad we're not doing exactly that anymore, but also having someone who is actually like explicitly, you could bring your mentor or you could bring and probably even better, like sort of an objective third party to those meetings to try and help navigate. Sounds like a really great idea. I just want to amplify a couple of things that I heard from that last discussion. One is this concept of joy and joy in work, and the Institute of Healthcare Improvement actually, who works on the sort of triple, quadruple aims for healthcare, has also started looking more at joy in work as part of provider and clinician well-being, and being able to find that joy in work. And as Rocky said, defining what that is, whether that's your community, like Abby talked about, or a specific aspect of your job, really does help with retention, and burnout is inversely related to the amount of satisfaction and joy that you can find in your work. And I also just want to mention, as Sharon said as well, that sometimes that joy could also be connecting you to an even larger community. So your community at WashU, but as depending on what your job is and what your interests are, but finding your niche in national organizations and national committees can also build your community so it's even bigger, so that then you have extra friends and extra resources kind of outside of WashU across the whole country, that you can also connect with and learn from, and they can sponsor you for other things and you can help them. And I think that's a really great way as well to find extra meaning in the work that you're doing, when you may lose a little focus when it's all local work. So no one else has taken Dr. Fraser up on her encouragement to put a question in the Q&A, but thank you for those of you who have. Really appreciate everyone. Oh, wait, now I have two. Oh, this is so good. Any thoughts on the faculty evaluation, on including measures of other things, such as the faculty's sense of their life, fit, balance, belonging, etc.? So is there any way to include that in the form as something to assess with the leader? So thoughts from the panel?
So go ahead, Vicki.
Oh no, Sharon, go ahead.
No, I was going to say, so I think we tried to expand the faculty evaluation form so it would encompass a lot of additional things that faculty members were doing and felt were contributing to the WashU community and the DOM community. I do think that you know, we've heard this from several people, that sense of culture is really important. And I'm not sure if that's what you mean by life fit, but I do think as we try to, and I know Dr. Fraser is very dedicated to this, to make things more applicable to everyone within the department, and to sort of reduce these disparities, either perceived or actual, and to make everyone feel like they're on an even playing field, and to enhance sort of the community, but also the culture, the sort of supportive and collaborative culture that I think we all are striving for. Hopefully that will address some of the life fit, because people won't feel like they're in it by themselves, or like this is not a good fit. But I'm not sure if I'm addressing what's implied by life fit.
So one thing I think, you know, that it is a annual evaluation form, and I think it was structured and very well developed, you know, by AWAM to address the key components that would lead to promotion and career development. But it obviously can't address everything in your life. We do regular culture climate surveys through the Office of Faculty Development, and we're in the process of updating that survey again. And with Dr. Ennencott, the goal is to really be able to do that annually, so that we can have information that is for the whole department and by divisions to help understand culture, climate, if we have hotspots, ways we can improve, you know, I think what is this work fit, work-life balance, you know, how the culture and the climate of the department. And I think that's probably a better place to gather that information, because it allows people to give anonymous, you know, more comprehensive feedback. It's not directly involved with your boss, and also provides more sort of population-based information for us to act upon to make interventions, as opposed to, you know, one individual at a time. I think that one individual at a time support, mentoring, intervention also can be addressed through a number of different venues, but I think it might be a little conflicted actually to put it on the annual evaluation as a structured element.
We did get one last question from Dr. Spencer for Dr. Fraser. If we have one extra minute, I think, Rocky, is it okay if we do one last question? Rocky says yes. So how did you become such a champion, supporter, and sponsor of women when you may not have had the same opportunities to be lifted up by women when you were coming up in leadership?
So thank you for that question. I think I have been very fortunate to have had great mentors, most, but not all of whom were men, and people who really cared about me as a person in my career. And I think as a division chief and then as a department chair, I had a wider scope of influence and recognized, I think, the importance of leaders to really step up, whether they are men or women, but the leaders to ensure that we are lifting everybody up. And I think the other thing I recognized was that there are structural barriers. There clearly are within academic medical centers structures, processes, policies that are structurally racist and structurally sexist, and that really it's on the leaders to identify those with the faculty and staff and trainees and dismantle those so there is a more equitable, playing field. And I think, I have learned a lot over my many years of working here, both from wonderful trainees and faculty and staff. And then I have been, doing a lot of reading and sort of soul searching about this. And I think if we all engage and understand the structural barriers that exist, that we all can make a huge difference to make it better for everyone. And then it's a better division, it's a better department, it's a better medical school, because if we are more diverse and successful, then we will be a better institution.